morning, everyone. For those of you who haven't met yet, I'm Dr. Sletton. I'm the clinical director of the pain rehabilitation program here in Florida. And we are starting Family Day, which is a very important part of the pain rehab program. Your presence here as family and friends is very important because we fully recognize that chronic pain and chronic symptoms and what your loved ones have gone through does not happen in a social vacuum. It affects families and occupations and neighborhoods and all sorts of things, and so we're glad you're here to kind of support and understand. There's sort of two main functions of Family Day. This morning, after a short video, we're going to review one of the major topics of the program, and this happens to be week 2. We're going to review cycle of pain, which is one of the major topics. After this hour, families are invited to stay in the area, and at 11 o'clock we'll be joined by the family members from the other team, and we're going to have a question and answer, a family-only time. So the 2 hours that we have together can be very productive, I hope, to explain some of the program aspects and then also answer questions that you might have. So this morning we're going to cover cycle of pain and some other related aspects after this short video. So what the video introduces is a topic that we talk about every single week, and we use a slightly different term. We talk about central sensitization. This idea that medical problems can change from an acute short-term problem to a long-term chronic problem, and much of that chronicity, that length of symptoms, is due to changes in the nervous system, both in the body as well as in the brain and spinal cord, and I'll unpack that in a moment. Just a quick other word of introduction about pain rehab itself. The concept of pain rehab is not new. The earliest programs in the country started in the early 1970s, and so this has been an ongoing practice in the Mayo system since 1974. So this, even though it might be new to some of you, the treatment effectiveness is very well established in the scientific literature, and the treatment has always included reduction and elimination of strong medicines, attention to emotional distress caused by the symptoms, and physical reconditioning. And those points of emphasis remain today. That's what the program is about. Pain rehab is a very difficult program. 3 weeks of very hard work, consistent effort at behavior change, change in thinking, physical change, sometimes chemical change. It is a difficult thing for people to do. But the results are phenomenal, and we have tens of thousands of graduates now over the past 40 years who have gone on to live very successful, fulfilling, very functional lives, even in the face of some very severe chronic conditions. So the program is very hopeful in that aspect, and in spite of its hard work, can pay off dividends for our graduates. One other very important but difficult point to kind of relate is this is a program that flies directly in the face of all other medical approaches to chronic symptoms. Medical approaches to chronic symptoms have at their core this notion of, we're going to help you feel better to function better. Pain rehab turns it completely around, and we say we're going to help you function better so you have a chance to feel better, okay? So it's less direct, it's longer, it takes longer to take hold, and so it can be a bit frustrating, and we acknowledge that, but that's kind of the core philosophy. So every week I like to begin with just a very brief discussion of sort of our way of explaining central sensitization. And when we talk about central sensitization, we talk about the human nervous system, and this can be generally divided into two major components, central and peripheral. The central nervous system is brain and spinal cord. The peripheral system is sensory, motor, and autonomic. And all of these systems are integrated in normal human functioning. We have sensory pathways from our body, both inside our bodies and outside of our bodies, that send messages to the brain for processing. The brain then can send a message back to the body for movement. So we have these systems that are constantly in this feedback loop. And then the autonomic nervous system is the system that controls all of the stuff we don't have to think about. Heart rate, respiration, digestion, temperature regulation, etc. And all of these systems are integrated and constantly at play in both good and bad ways. So in the periphery, in the sensory aspect, we see impacts in skin, our skin, digestive system, our musculoskeletal system. Balance can be impacted. Vascular, nerves, vision, hearing, taste. So the implication from the body is that any part of our sensory system can change and begin to send stronger negative signals to the brain. And in fact, we'll get into this in more detail in another class, but these sensors are placed there, wherever they are, to do one job. You have photoreceptors in the back of your eye that are there to detect specific wavelengths of light and send a message to your brain. You have receptors in your digestive system that detect various aspects of your digestive status. Balance, musculoskeletal function. So every part of our body has these tiny little sensor cells that are there to send messages to the brain. And in fact, sensitization is neither good nor bad. If you've learned to prefer a certain type of food or a certain flavor of coffee, your taste buds have gotten sensitized, and that leads to preferences and tastes. So it's not always bad. But when we talk about central sensitization, your body has gotten sensitized to unpleasant sensory experiences. And I want to emphasize, and I will say this several times this morning, it's not just pain. We're stuck with the title pain rehab for right now, but sensitization can occur in people that have chronic symptoms of dizziness, digestive issues, temperature regulation issues, sensitivity to light, sound, smell, touch. It can be any number of sensory pathways that can become sensitized. So we're not just talking about musculoskeletal pain or headaches. It can be a variety of places. And once this pathway has been upregulated, the strength of the signal going to the brain increases. And one of the parts of the brain that gets affected is the sensitized somatosensory cortex. Quick word about this. This part of our brain is organized by body part. And so if I were to have something happen to my right hand, the right hand part of my sensory cortex would light up in response to something happening to my right hand. If something happened to my left foot, the left foot part of my brain would light up. And the reason it's important to understand that it's by body part is this begins to account for symptoms that can spread and change over time. We have many, many patients that start out with one specific source of discomfort or unpleasant symptoms, and now they have whole body sensations, or one part of the digestive system was impacted and now the whole digestive system's impacted, or one of the sensory pathways was impacted and now they all seem to be impacted. So the spread can occur based on brain organization. When this becomes sensitized, there's sort of two consequences, and this will lead into our discussion in a moment of cycles of pain. Symptoms can get worse. So patients can experience more pain, fatigue, feeling dizzy, nausea, numbness, tingling, etc. Symptoms can just generally worsen. And triggers to those symptoms can multiply. So over time, things like light, sound, taste, smell, touch, temperature, movement, all these things can now become triggers for more symptoms. And so if we just stop right there, we can understand that this gets to be a very confusing picture very, very quickly. Because now the person is saying, if it's too hot out, I'm bothered. If it's too cold out, I'm bothered. Certain foods are starting to bother me. Now I'm having this, and this symptom. And when you start to report multiple symptoms, you're going to get sent to the ologists. Okay? We'll talk about the ologists in a minute. Ologists are not good for your health. Okay? Because excessive specialty care can actually decline your health, not enhance it. We'll get into that in a moment. Now, if I stop here, and I will stop for just one moment to make 2 points. Point number 1. If you look at this model to this point, there is 0, none, zip, psychology. This is a completely physical process. This is not a psychological disorder. Neuroses, deep unmet, unrequited emotional needs, id, ego, superego, nonsense doesn't apply. Never did, but doesn't apply here. People with central sensitization did nothing wrong psychologically. They're not psychologically weak-minded. It's not a thing that they didn't try hard enough. It's a completely physical process, okay? But point number 2, as we will explore in a few minutes, there's also no more space for physical interventions. You can't unsensitize sensors. There's no amount of acupuncture, patches, ointments, massages, injections that are going to fix the body. We can't disrupt the signal at the spinal cord anymore. It's too little, too late. And the only thing that works on the brain is general anesthesia. And then you're a potted plant. So there's no space here for the traditional medical interventions to work anymore once this has become sensitized. And that actually feeds right into what I'm going to talk about in a few minutes with the cycle of pain and how devastating that can be. I need to add a few more pieces to this morning just to kind of conclude the first part. Another part of the brain that's impacted or can be impacted is the motor cortex, the movement part of our brain. It too is organized by body part. It sits in parallel with the sensory part of our brain. So if there's sensory sensitization, we can also see motor dysfunction. So we have patients that can come into the program that have seizure-like episodes. It looks like they're having an epileptic seizure and their motor system is misfiring. We can have people that come in that have shakes and tremors and movement difficulties. And it's in part because the motor cortex is sensitized just like the sensory one is. So that it broadens our clinical impact. We can help people that have unexplained neurologic or neuromuscular difficulties that aren't epilepsy, aren't necessarily due to a declining sensory motor problem. It's because of sensitization. Those people also have been misunderstood over time. Pseudo-seizures, psychogenic seizures, those are misnomers, okay? This doesn't start from a psychological process, it's a body change. Now, we talked this week also about some of the other aspects of the nervous system, including a structure that lies underneath the surface of the brain called the limbic system. The limbic system sits right below the surface of the brain, and it controls all the automatic processing that we have for sensation, emotion, and memory. It's like the emotional sensory superhighway in the middle part of our brain. Learning happens here, emotional responding happens here. This is also the system that can activate the autonomic nervous system in the body. And so if the surface of the brain is activated by excess sensory activity, it can affect the limbic system, and the limbic system can in turn affect the body. And so what we frequently see is emotion, sensation, and memory can be activated by these sensory changes, and now this can kick off the autonomic nervous system, and the two branches of the autonomic nervous system can come into play, the sympathetic and parasympathetic. Woo, got to the edge of the board there. And here's just something very quickly to understand about these two systems. They're in balance with one another. When we are active and engaged in life and stressed out and having panic attacks and having symptoms and good and bad things, the sympathetic system's more in charge. This is the system that raises blood pressure, increases breathing, increases muscle tension, decreases digestion. The parasympathetic system is our relaxation system. That's the system that needs to be engaged when we're digesting food and we're sleeping and resting. And the tension we see in the program is the sympathetic system can be activated by stress and symptoms on top of normal life things, and that in turn inhibits digestion, sleep, other restorative functions. So now you can start to see this picture come together where increased sensations from the body cause increased brain activity, which leads to increased activation of the limbic system, which leads to activation of the sympathetic nervous system, which leads to more symptoms. And over time, we get a forward feedback loop where now we have this mechanism that symptoms can beget more symptoms, can beget more body reactions, which can make more symptoms, and now all of a sudden, the points of entry become multiple. And this is where things like stress and behavior and emotion start to play a role. They were not in the initiating events. They weren't the original things, but now they have a role in maintaining the problem. And that's why all throughout the 3 weeks of the program, we focus on physical, emotional, and behavioral elements of this problem. We can't parse those things out. They're inseparable. And so when we look at what to do about all of this, since we can't go and change the body, and this is a very hard system to disrupt directly, we have to look at what we call the 4 reactive and maintaining factors: physical, emotional, behavioral, and chemical. These are the factors now that we know keep feeding the fire, so to speak. And we use very often this analogy of a forest fire. Forest fires are treated very differently than house fires. You cut off the fuel sources. You try to let them starve themselves out. You can't just directly put out a forest fire. And so once this sensory motor fire has taken hold, as I mentioned a few minutes ago, we no longer have a direct mechanism to put it out. There's not just enough medicine or just enough therapy or just enough acupuncture or just enough massage that's going to stop this. In fact, many of those things now will make the problem worse and not better. And so our only opportunity here is to cut off the sources of fuel. And so pain rehab, as we practice it right now, is all about eliminating physical deconditioning and the physical limitations. It's all about helping people maintain a better emotional health state, decreasing stress, anxiety, depression, anger. It's all about changing behavior patterns, eliminating pushing and crashing and pain behaviors. And then thirdly, it's about reducing chemical activity in the brain, removing those unnecessary medications. So this is our explanation for what's happened. This accounts very nicely for what our patients have experienced. And the nice thing about this model is it doesn't matter in terms of a time frame. This can happen in an instant for some. This could happen because of a surgery or an accident or some precipitating event. For others, this can happen over years. A migraine headache pattern that started to be every month and then every week, and now it's all the time. And the person's had migraines for 25 years. This could be irritable bowel. This could be someone with cyclic nausea and vomiting. It can be any number of causes, but the model then allows us to look at what can we actually do, and this is the answer. This is where we can intervene. So with that as a backdrop, and I think it's important to understand this is our current state of the science and why PRC works and how it works, I want to pivot over to an older concept that we've been talking about for a long time called the cycle of pain, and how that can sort of overlap with this concept. Now I'm going to start with just a generic inciting event. I've already said that this can happen for a multitude of reasons, but just for the sake of illustration this morning, I want to just say something happened. Illness, an injury, some inciting event. And when something happens to us, we're going to go to the doctor and get checked out. You wake up and you don't feel well, something hurts, something's bothering you, there's some problem, you're going to go get it checked out. And very often, the initial things that your doctor might suggest help you feel better. Those pain pills, those first pain pills, or why don't you rest, or if it hurts, don't do it, or here's a physical therapy thing to try. Very often, those things work at the beginning. And in fact, as we'll talk about in another class, about 90% of all healthcare visits actually stop here. Not just with central sensitization, but across the population. You go into the doctor and you've got a sinus infection, you're going to get antibiotics and you're going to be done. Hot appendix, appendectomy, broken ankle, cast. We're done. But if this is starting to happen, for whatever reason, the symptoms are either going to return, persist, or worsen in some ways. We're starting to see sensitization set in. And when sensitization sets in, it's very logical to go back to the doctor. Hey, doc. It's not working anymore. Those pills aren't helping as much. The physical therapy isn't making me feel better. And when we go back to the doctor in this modern era of medicine, we enter the world of the specialists, which is plural for specialists, which means a lot, okay? And specialists do 4 things. They test, they diagnose, they medicate, and some do interventions. Now, since I have this on recording, my statements will be saved in perpetuity, but here's what I'm going to tell you. I'm a specialist. I love specialty medicine. I have worked at the Mayo Clinic my whole career. Perhaps you've heard of it, a specialty care clinic of some repute. We're number 1, okay? So specialty medicine isn't the problem. Specialty medicine, in fact, is the tip of the spear in terms of medical innovations, the breakthroughs, the miracles, so to speak. The problem is, with that system, specialty medicine is a terrible fit over time. Our patients all had to see specialists to get here, had to have things ruled out, had to have certain conditions treated. That's not the problem. But continued exposure to specialists can be harmful to your health, because each go-through with the specialist is going to be a deeper dive into the body, more extreme tests, more extreme medications, more extreme treatments, and it gets muddier and muddier and muddier, and health can suffer as a consequence. Let me use each one of these as a quick example. Tests. medical tests as a whole are quite accurate these days, but they're not perfect. And medical tests, whether they're an MRI or a blood test or any kind of test, are open to specialist interpretation. So you take technical data and you put them in the hands of humans. We have two problems. The data can have error in it because of just experimental error, and the human can screw up as well. And you can go to different specialists and they can interpret the same test very differently. One might see that spot on your MRI which might represent something that needs to be cut out, and the other one's like, no, that was just a smudge because the radiologist had a donut. And you know, it can be interpreted very differently. Some of the tests themselves can make symptoms worse. EMGs, needles in sore muscles attached to electricity. It's a very painful procedure to test things. It can be very important, but it can cause pain. GI testing. Go lightly does not mean go lightly. It means go heavily for a long time until you're a hollow tube. And then we're going to stick hollow tubes where hollow tubes ought not to go very often, and we're going to just look for stuff. And I've had patients that have had 4 or 5 colonoscopies in a year. Repeated invasion into the gut is going to stir up the gut. So the tests themselves can be difficult. The musculoskeletal exam, the mashing on your muscles and moving of your joints in ways your joints ought not to move to see if it hurts. Yes, it hurts. And you leave a musculoskeletal exam like a disarticulated bullfrog with fibromyalgia. If you didn't have it on the front end, you got it going out the back end. So tests can stir things up. They can be inaccurate. And then they lead to diagnosing. Now here's the problem with diagnosing. It too is an educated guess. And you can have 3 highly qualified, board-certified specialists say things like, you've got the problem. Next one would say, you might got the problem. And the third one says, I'm not sure, but we'll check you again in 6 months. And so even this little tiny part of the cycle can go on for weeks and months and sometimes years and lead to uncertainty. And most of our patients start out locally. They go to their local specialist, then they go to their big city specialist, and then they go to their big city medical school specialist, and then they go to a place like the Mayo Clinic. And they've been investigated 3 or 4 or 5 times. And so it gets very, very confusing. And here's another thing. Once you get a diagnosis, you know what you do? You go get a second opinion from Dr. Google. And Dr. Google's not even a doctor, okay? Here's the problem with Dr. Google. You have unfettered access to highly technical material without a perspective. And you type in headache and it pops up brain tumor, aneurysm, stroke. And the problem is you're stressed out and you drank too much last night, okay? It always comes up with the worst case scenario. And then you think you're going to do a little investigative research about your medical condition, and you start linking things like that rash you had 3 months ago with your headache and that fever you're quite certain you had a month ago, and all of a sudden you've got dengue fever and you've never even been to dengue. And you can diagnose yourself with some awful things and terrify yourselves. And family members help us out, stop researching, tell Aunt Edna to keep her Google research to herself. It's not helpful. And then medications. We talked a lot about medications this week. Polypharmacy is devastating. Taking too many medicines of too many different classifications is very confusing and possibly harmful to the brain and the body. And what often starts out, especially in pain, is you go to the doctor and you start with a pain pill, a muscle relaxer, and an anti-inflammatory. And when that doesn't work, you're going to go back and get a long and short-acting pain pill. And now you can't sleep, so you get a sleeping pill. And now you can't stay awake, so you get a stimulant. And now the stimulant's causing you to have hypertension and panic attacks, so you get a Xanax for your panic attacks. Now your headaches are worse, so you have to up your headache medicine. And now your gut's on fire because you're taking all these chemicals in that your GERD's just kicked in, so you have to take GERD medicine. And you feel like you're going to puke all the time, so you have to take vomit medicine. And you can't poop, so you have to take poop medicine. And pretty soon, you're on a ton of medicines. And then no one should die without trying Neurontin, so you get put on Neurontin. And before you know it, you're the little old lady who swallowed the fly. If you know that nursery rhyme, she starts out with a fly, and several animal species later, she swallows a horse, and she does in fact die, okay? And a quick side note about nursery rhymes, just as long as we're talking about them, don't read them to children. They are all about death. Little Boy Blue, okay, you know why he's blue? He's not breathing. Ring Around the Rosies is about the Black Plague. And here's my favorite. Now, I can just imagine the couple talking about this one. And down will come baby, cradle and all. Who thought it was a good idea to put that kid up in the tree in the first place? Well, honey, I thought he'd be safe from the animals. And you've got a DCF investigation on your hand because the kid just fell out of the tree. So nursery rhymes are terrible. Another cultural reference, for those of you that are old enough, is Jefferson Airplane, Go Ask Alice. One pill makes you taller and one pill makes you small. That's what we do all the time in medicine. Treat this, treat the side effect. Treat that, treat the side effect. And pretty soon, your poor brain doesn't know whether it's coming or going. The other problem with a lot of these medicines is the addiction potential is extremely high. We are in the midst of an opioid epidemic caused by the pharmaceutical companies and pain doctors overprescribing pain medicines. There has been this misheld belief that we can eliminate pain with the right pharmacy blend, and that some people believe pain is an opioid deficiency, and if you can just get the right amount in your body, you'll be fine. But study after study has shown that even when patients are comfortable, they don't get more active. So this is a very vicious part of the cycle. And then finally, interventions. Every intervention that can be done to the human body has two major problems. The body adapts and works around the intervention, and interventions, especially that invade our body, leave behind scar tissue and cut nerves. So they were not without side effects either. Now, in the last few minutes that we have, I have to go to town on one other area. Alternative medicine. Here's the problem with alternative medicine. It's alternative for a reason, okay? And for central sensitization and the difficulties that our patients are struggling with, this is a disaster, okay? Here's some reasons that this is a disaster. At the very least, if it does nothing, you've wasted time and money and engaged in pain behaviors. But much of this is unregulated, unproven, and is performed by very nice, lovely people who are true believers in what they do, and they can become your friends. I've had so many people over the year, I can't go back to my massager, like she's just a lovely person. You know why she's a lovely person? You're paying her $75 a week. She's a rent-a-friend. But she seems to really care about me. Sure, don't pay her 1 week and we'll see how much she cares about you. And here's the problem. Some of these alternative treatments can actually make the problem worse and not better. Look at this model. If you think about the sensory pathways and the fact that we're trying to decrease the activity up here, let's talk about therapeutic massage for a second. There are no toxins to be released, okay? And the tiny little knots in your muscles are little fasciculations that are best relieved by exercise. And yet Helga with the big elbows does body work on you at her Neuromuscular Massage Institute of America, and you leave there like a wet, sore noodle, and you're quite sure she has hit all the spots. And in a couple days, you start to feel better. You know why you felt better? She stopped mashing on you, okay? If you're into that stuff, go to Lowe's, buy a rubber mallet, hit yourself in the hand a few times. It feels good when you stop. There's no therapy. And as far as neuromuscular re-education, these are just pieces of meat. There's no educating your muscles. Education happens up here. Muscle memory happens up here. And so there's thousands and millions of dollars spent every year for repeated therapeutic massage. It's not therapeutic. And it can stir up the pathways. It can be harmful. Chiropractors. They've gone from the back crackers of yore to diet experts, cool laser therapy experts, allergy experts. Some of them don't even touch their patients anymore. You know what a cool laser is? It's a pen light. There's no therapy. And you go back every week for an adjustment, and he's such a nice doctor, and he's got those soft, gentle hands, and you know, that's from handling all his money, by the way. He doesn't want to get his, you know. And if someone, let's think about this. Chiropractors are famous for saying you need to come back every week for an adjustment, right? If a mechanic told you your car needed to come back every week for an adjustment, would you not get a new mechanic or a new car? Your bodies don't need weekly adjustments. Your ribs aren't floating, your sacroiliac joint does not need mobilization. It's just another set of therapies that are going to lead nowhere. Acupuncture, we could go on and on. A couple that I want to point out that are common to what folks go through in the program, diets and supplements, okay? Central sensitization is not a dietary insufficiency. It is not a lack of ginkgo biloba, okay, or saw palmetto, or milk thistle seed, or anything like that. And what's happened in our culture is we like to find dietary culprits. We like to find something in our diet that we're going to target. It was fat, and then it was sugar, and then it was fat and sugar, and then we were supposed to eat like cavemen. And now we have the current gluten is the culprit, okay? Gluten has been in whole grains since the beginning of time. It wasn't something that the Soviet Union put in the wheat in Kansas in the 1950s to kill Americans, okay? And yet we have a narrow band of people that cannot tolerate gluten, a real live disease. It's called celiac. They don't have the enzyme. They get sick if they ingest gluten. And we've taken a disease group and said, well, if they can't tolerate gluten, we probably shouldn't have gluten either. That's just dumb. If you can tolerate gluten, it actually helps vitamin and mineral absorption. It's okay. But what people also do is they go on these elimination diets. Well, I'm going to stop eating this for a while to see if that's what's causing my problem. Well, when you eliminate something, you get sensitive to what you eliminated. If you don't drink soda for a month and you crack open a Coke, it's going to feel really fizzy and really sweet because you haven't had that in your digestive system for a while. It doesn't mean you developed a Coke allergy in the last month. And yet there's books out there, these anti-inflammatory diet, the gluten-free diet. It's all over the place, and it's not going to help. And you become obsessed with it, and you eliminate stuff, and you could impact your health. The final two categories, the nothing new under the sun category, copper and colon cleanse. We have Brett Favre now with the Tommy Copper sleeve and the Tommy Copper socks and the Tommy Copper underwear. Remember Grandma with the green skin from her copper bracelet for her rheumatism? We're back to that. I'm sure magnets are right around the corner, and we'll have magnet inserts and magnet pillows and magnet sheet liners or whatever. Colon cleansing. So we have the Britney Spears colon cleanse diet. I feel like a Mouseketeer again. Well, you know what? Colon cleansing is not necessary. Your colon is perfectly happy being a sewer tube, okay? This goes back to the 1860s, at least in America. Battle Creek, Michigan. A man named Kellogg and a man named Post ran a sanitarium for rich people where the rich people got a daily colonic, which is a nice way of saying enema, and they ate high-fiber cereal because Mr. Kellogg and C.W. Post believed that colon cleansing was the seed of health. It was the birth of the cereal industry in America. There's nothing new about this stuff. And yet Oz or somebody else will shill it on one of their shows, and all of a sudden it's just the rage, and you see it on all the magazines at the grocery store line. There's no benefit in it. And to me, the most insidious problem of this is even if it's harmless, even if it didn't do you any harm, which I would argue some of these can be very harmful, it's a waste of time and money and effort, and you're barking up the wrong tree. And it becomes a pain behavior. You start thinking more and more about what you're going to take into your body because of your symptoms. That's a pain behavior, and it keeps those pathways stirred up. So before we quickly go over the last two things, I want to give everyone some consumer tips. If a practitioner of any type says cash, credit card, or will finance, leave the office immediately and make sure you've got your pocketbook with you, okay? That's not how healthcare financing works. If a practitioner said they are the only person in the world that's ever figured out your problem, leave immediately. That's not how science works. We share information. We try to disseminate information. We don't try to hold it in to ourselves. And the longer the name, the greater the index of suspicion. Let me demonstrate. Mayo Clinic, 4 syllables, okay? But the Neuromuscular Technical Reinstitutionalization Massage Parlor of America Clinic is probably hiding something. So the more words in the title, the more sketchy I would say it is. So just be vigilant. And if they overpromise, they're likely to underdeliver. You just need to be aware of that. Now, on top of all this, we see emotional cycles also develop. We see depression, anxiety, anger, stress, guilt, confusion, frustration, etc. This is all the emotional distress stuff that we see develop along with this cycle. Because imagine you're going through all this and somebody's like, hey, I've got this figured out. You get a little hopeful for a minute, then all of a sudden that didn't work, and then you're hopeless again. Or you're angry and frustrated and confused and like, why'd they say that and they said something different? It's a very tumultuous time in terms of emotional functioning. And then finally, the behavioral part, we see pain behaviors escalate, pushing and crashing. Something over here makes you feel better for a minute. You think you're healed. You go back and rake the yard, change the oil, clip the dog, reshingle the roof, and then you're in bed for the next 3 weeks. Feet's pushing and crashing. And then finally, we ultimately see a lot of withdrawal. I don't know what to do anymore. I'm just going to go to bed. I'm just going to hang out. I don't know what to do. So the cycles of pain directly impact this. And the reason we talk about this as a program is not to beat anybody up. I don't want any person in the room right now that's gone through this to feel guilty. But I do want you to look at it as a warning sign. Because as is a well-known phrase, those that fail to learn from history are doomed to repeat it. And this is right out there ready to gobble you up again, and the results can be devastating. This is harmful to our patients' health when they have central sensitization. So it's a difficult pattern, it's one that needs to be broken, and it's one that we work on all the time. So that's cycles of pain as it relates to central sensitization. So we'll end with that, and then we'll take questions. Thank you.